Fortunately for me, I'm with Dr. Lawson. He's one of the special doctors that comes into the studio that every time he's around, everybody always has something to ask him. Hey, Doc, you see, this, but Dr. Babajide Lawson is an orthopedic surgeon. And today, many adults suffer limb deformities of one type or another. So Dr. Lawson is going to be talking to us about these leg deformities in adults. Welcome back to the studio, Doc.
Thank you for having me.
All right, now, so when we hear the word deformity, sometimes it just gives alarm bells, off in your head. But there are some very minor deformities as well as major ones. Yeah. But which are the most common that you see in your doctor's office?
Okay, the first thing is the word deformity as applied to the limbs would just signify deviation from the normal.
Okay.
However, not every deformity is one that you would bother about, except it affects function.
Okay.
So you may talk about having bow or K-legs.
Okay.
Now, nature has created a range that is functional. So it may not be as cosmetic as you'd like it to be, but it may be functional. So if it's functional, we tend not to bother about it.
Okay.
However, if it is beyond that range, there's a tendency that you may not function as well as you should, and you may end up being in pain.
Okay.
So more often than not, the usual complaint is deformity and pain.
Pain. Okay.
So usually when the patients come in, and most of the deformities revolve around the knee joints. So you get to see knock knees or very bad bow legs, or what we call a Winthrop deformity.
Okay.
In which case one leg is bow, one leg is K.
Okay.
And now the thing is, some of these deformities are things that would occur in adulthood over time. And some are as a consequence of problems from childhood, things like Blount's disease, which is somewhat commoner in blacks. So, and that usually is as a result of the poor development of the inner part of the knee.
Okay.
So the outer part continues to develop and grow, the inner part doesn't. So that leaves the person with a really pronounced bow leg.
Okay.
So over the years, that inner part tends to wear faster and then can result in pain as the person walks.
So I know a lot of people have, sort of learned to live with some of these things.
Yep.
And they have found different methods of living with either the pain or the less cosmetic part of things.
Yeah.
So what is the advice you give patients that maybe over time have just decided, you know what, I can't live with this anymore?
Okay, first things first would be to really to assess the patient, assess the individual. Is there a problem? And what is the nature of the problem, and what form of intervention is available for the problem? Now, more often than not, for the knee issues, either really very bad knock knees. Now, again, the thing is pain. Now, if the pain, so the pain now depends on how much limitation of function goes with the pain. So sometimes it's just enough for rehabilitation, in which case you get them to have physiotherapy.
Okay.
Now, but the problem also now is that in assessing the pain, you should also assess the deformity. Some of the deformities are so pronounced that it really is not just enough to leave them to have physio. You may need to adjust the mechanical axis.
Okay.
So basically it's like, because it's deformed, the process of walking is not efficient. So if it's not efficient, then it's just only going to get worse.
So is it the inefficiency that's causing the pain, or is it vice versa? The pain that's causing the inefficiency?
No, the inefficiency is what's causing the pain.
Okay.
Because over time, the process is not effective, so it will result in pain, because it will result in the joints getting worn out. So sometimes that could also happen in individuals who've had accidents and fractures that probably did not heal well.
Okay.
So, and that alters the axis. So the thing there is the locomotive system, that is your walking, your lower limbs are a mechanical system. And if the axis is not properly aligned, just think of your car.
Okay.
So if your shocks are off or your axles are bad, then there's every likelihood that something will continue to give and it will wear. After a while, your tires could get bad. So it's something similar.
So it will just lead to other problems down the line.
Exactly.
And of course, your car will continue to make noise.
Yes.
All right, all right, all right. So I'm connecting there, you know, but I have to say, I have to go back to this issue of pain and pain management. Because there are quite a few people who have been living with pain for a long time and have, in essence, sort of gotten addicted to these pain meds. So what limits do you put in place for people with leg deformities when it comes to pain medication?
Okay. Treatment management usually is in stages and phases. So when the person is first of all assessed, you do determine if they fall into the category for physio.
Okay.
Now, when they are getting physio, you give drugs to make the physio process easier. Now, you review periodically and determine if they are making any progress. If they're now not making any progress, so each condition has modality of treatment and steps. So if they're not making progress, you escalate to the next level. And usually at the first interaction with the patient, you outline the treatment options and the stages that you'll have to go through, so that by the time you're now not getting the desired result from this particular stage, you know that you need to, exactly, and the patient too would anticipate.
But there's some people that have been on a particular medication for maybe 3-4 years, you know?
Yes.
So how does that work?
Usually sometimes what happens in those cases is that such individuals may have been offered surgery.
And they refuse
and there's a tendency for us to be averse to surgery in this environment.
But surgery after a long period, if it's not getting better, might just be the only other option. Dr. Lawson, it's always a pleasure having you in the studio. Honestly, the way you break some things down, it just gave me a very clear picture of what exactly is going on. If you have a question or two for Dr. Lawson, you can always use our social media handles at TVC Connect with the hashtag WakeUpNigeria on TVC. We have to take a quick break now, and we'll be back.